Hello, everybody, and welcome to this webinar. I'm Kathy Gerwig. I'm your moderator for this hour, and I serve as an advisor on healthcare sustainability and climate action, and I am lucky enough to get to work with all the organizations who have joined together to bring you this session. During the webinar today, we're going to be using an audience response system called Slido, and I'll introduce you to that in just a moment. We're not going to be conducting a Q&A open session during this hour, but I encourage you to please utilize the Q&A tool that's under the live stream. It will be monitored by National Academy of Medicine staff, and you'll be able to interact with one another and ask questions. So with that, let's get right to it. And on the next slide, we have our run of show. And what we're going to be doing today, I'll just go through very quickly. After some introductions, we're going to hear from an expert panel on very practical information about how to decarbonize your health system. And then we're going to hear from the organizations that are hosting this event. Each of them have really excellent tools, and we're going to put those into your hands. So let's get to the Slido on the next slide. To kick us off, I'll have a question for the audience using this feature. So what we'd like you to do, as you see on the screen, you can either scan that QR code using the camera on your phone, or you can go to the website as shown here, slido.com, and then you enter the code 3855546. And the following question should appear on the screen, and you'll submit a response. And the question that you'll be getting is, what is one word that comes to mind when you think about climate action in healthcare? And as you submit your answer, your responses are going to be part of a word cloud, and we're going to wait 30 seconds or so you have time to get into the system and answer. So we're going to hold here for a moment. Please enter your word, and then we'll look at our word cloud. So let's go ahead and see on the next slide, if we can, what is popping up. I like that green is the very first word that comes to mind. Thank you for that. And urgency, yes. Also a very critical reason why so many people are joining this webinar today. And we'll give it another second. Well, inadequate strikes me as very important. Crucial. Equity. Thank you for bringing that lens to it. All right. Thank you so much, everybody, for chiming in and letting us know what your one word is when you think about climate action and healthcare. And let's go ahead and move to the next slide now. To just review the objectives of this session really quickly. We are going to identify steps you can take to lower carbon emissions at your health system. We will hear from two leaders who have been in this work for a long time, and they're going to talk about how they've achieved success and the lessons that they've learned. And you'll get a list of publicly available resources to help you plan, prioritize, measure, take action. And I want to just give a special shout out to those of you who are newer in this journey. You'll be getting great information on where to start and where to go for help. So I hope that sounds good to all of you. And with that, we'll move right along to the next slide. And I want to introduce our host organizations. So starting with Healthcare Without Harm, they work to transform healthcare worldwide so that it reduces its environmental footprint and becomes a community anchor for sustainability. They're a leader in the global movement for environmental health and justice. They have a sister organization called Practice Greenhealth. It's a membership network of more than 1,500 hospitals, and they are the healthcare sector's go-to source for information, tools, data, resources, technical support, etc. Next, we have the Institute for Healthcare Improvement, or IHI. Their purpose is to improve health and healthcare worldwide, and this includes bringing quality improvement methods to meet the challenge of the climate crisis. Last year, they worked with the Agency for Healthcare Research and Quality, AHRQ, to create a simple primer on decarbonization in healthcare. And if you don't have that primer pinned in your tabs, I recommend that you do so. This year, IHI is partnering with a small cohort of healthcare organizations to apply quality improvement methods to accelerate the shift to lower emissions care delivery. And then we have the National Academy of Medicine, NAM. They are recognizing the critical need to address climate change through health sector leadership. So NAM launched the Action Collaborative on Decarbonizing the US health sector. It's called the Climate Collaborative. It's a public-private partnership of leaders from across health systems, suppliers, educators, and others who are committed to addressing the sector's environmental impact while strengthening sustainability and resilience. What they all have in common, all these organizations, is work devoted to addressing climate change as a health crisis and working to reduce the health sector's hefty contribution of 8.5% of greenhouse gas emissions in the US. So moving to the next slide, I have the enormous pleasure of introducing Dr. John Bbus. He's acting director at the Office of Climate Change and Health Equity, or OCHE, and that's part of Health and Human Services. He's a physician and public health professional with over 25 years of experience in this area. Before leading OCHE, he was senior advisor for public health in the National Institute of Environmental Health Sciences. And before that, he was chief health scientist at the Environmental Defense Fund. I just want to note one more important thing, given our host today, is that he was elected to the National Academy of Medicine in 2021. So, John, thank you so much for being here, and please take it away.
Great. Thank you so much, Kathy, for such a warm and lovely introduction. And I want to thank the host, the National Academy of Medicine, the Institute for Healthcare Improvement, Healthcare Without Harm, and Practice Greenhealth for the honor of having me join the webinar and to help introduce it. It's end of August, right? The summer of 2023 is drawing to a close, and it has certainly been a summer to inspire action from all of us. We've had record fires burning week after week after week in Canada, darkening the skies, causing air quality to plummet in New York City and Boston. We've had an endless record-setting heat dome in the United States and other places around the Mediterranean, around the world, with July shattering records. And of course, we crossed the 1.5 degree threshold that we've been trying not to cross above early industrial time periods in July. We've had hot tub water off the coast of Florida, 100-degree Fahrenheit water killing coral. And now we're all watching the news and seeing that warm water in the Gulf, 88, 89 degrees, fueling Hurricane Idalia and threatening a severe hurricane season to come. If you're seeing this, if you're open to it, if you can tolerate thinking about it, you're worried and scared, and I want to acknowledge that we're all worried and scared if we are seeing these things. But the best thing we can do is act. If you're seeing it, you know we have to act urgently, not just to protect people in the face of these, but to reduce greenhouse gases as a primary cause of the worsening of the extremes that we're seeing. And as Kathy said, we know the health sector is a significant polluter, and that we as health professionals have an ethical obligation to minimize our own pollution. The good news is this webinar. There are resources available, especially resources available through the Inflation Reduction Act, or the IRA as we call it. It's an unprecedented opportunity, especially for the nonprofit sector, to get actual financial support for decarbonization and resilience. So this is why we're here today. We're here to pivot to action, to share with each other, to learn from each other. Our Office of Climate Change and Health Equity within the Department of Health and Human Services is working to build communities of practice like this, including through our partnership with the NAM and the Action Collaborative, to achieve decarbonization of the health sector as rapidly as possible. We launched the White House HHS Health Sector Climate Pledge on Earth Day over a year ago. That group continues to grow as one community. We've created another learning network of US federal health systems to speed decarbonization of those massive systems that are some 14-15% of the nation's hospital beds. And we've uniquely engaged with the federal agencies that are managing the financial programs of the Inflation Reduction Act to create the IRA Quick Finder and our online health sector resource hub, which you'll be hearing about in a few minutes. So we're acting as an office to take those next steps to support the sector in this move and to really focus on full-scale implementation. The time for that focus on full-scale implementation is now. We need reporting, we need accountability, we need to be evaluating our progress, we need to put this in a quality context, we need the analytics, technical assistance, but most of all right now, the sector it really needs to avail itself of the access to financial resources to help. We have the solutions, we know the first steps, and the financial resources are coming in place now in this year. So without further ado, I really look forward to the discussion, to the presentation of the resources that all the groups have created. And with that, Kathy, let me turn it back to you.
Thank you so much, John. Really appreciate you joining us today and welcoming people. And now we are going to move right into a panel. We have two people I greatly admire here who have a ton of experience in healthcare sustainability and decarbonization in particular. We have Miranda Skoning. She's the Sustainability and Energy Director at Parkland Health in Dallas, where she has led this work for the last 10 years. Her initiatives have saved millions of dollars and helped Parkland gain recognition for its sustainability program. And we have Shane Dunn. He's the Sustainability Program Lead at Memorial Sloan Kettering Cancer Center based in New York. In his 8 years there, they have received 8 consecutive top 25 environmental excellence awards from Practice Greenhealth. He serves on a number of national and international leadership groups related to sustainability and climate action. So we need to get right into them sharing their expertise. So my first question, I'm going to ask this of both of you, but Miranda, I'll start with you. I want to know how you make the case to leadership. What is the why that you talk about that is so convincing? And if you could also talk about how sustainability fits into your organization's strategic plan.
Yeah, so whenever we look at doing sustainability, it does all fall back to our strategic plan. So a couple of the main things there we look at is one, what we call taxpayer investment. So basically saving money. And then also we look at our community health. So how is this impacting our community? How is it impacting those beyond our walls? So that's kind of our main selling point that we look at, and taking it to kind of an environmental perspective related to health. So how do we put those two together? So whenever we did this in the beginning, it was more of kind of money talks. So we did a lot of cost savings initiatives in the beginning, and now it's moved towards more, yes, we're continuing to save money, but also we are looking at that connection between the environment and health. And when we do present those, we make sure we have a very solid business case using a lot of data. So that's how we present it.
Great, thank you for that. Shane, how about you? Some of the same, anything different that you use in your why to leadership?
Yeah, I mean, definitely similar. You know, we define our objective and really value proposition. We take a 3-pillar approach, addressing environmental, economic, and social stewardship throughout the organization. So we're looking to multi-tiered benefits, reducing our environmental impacts while saving costs, providing community benefit, promoting the health of our patients, staff, and community. And even those soft costs, you know, providing positive brand recognition, staff recruitment, retention, staff satisfaction. And, you know, we have a very lean setup. We do it mostly using internal resources, really plugging into the operations. So we went for, as Miranda mentioned, you know, cost savings, low hanging fruit, easy wins, and really focused on the framework, having a defined program for a value add. And like we said, it's no secret that healthcare has exorbitant impacts from the energy we use, the supplies that we purchase, the waste that we generate. And, you know, it was mentioned 8.5% of US-based greenhouse gas emissions from the industry. So a lot of that fits into the why, really putting together a very data-driven approach with solid business cases as well.
That's great. And you both mentioned data. So I do want to come back to that with some specific examples, if you would, to help us understand exactly what is the shape of that data and how you present it. It would be helpful. And maybe feel free to include that in this next topic because it's sort of related. And I'll start with you, Shane. Can you talk about the organizational structure and what you have learned about creating the ideal organizational structure and governance structure for this work? What does it look like today in your organizations? And for those people who are just sort of setting up their structures, what insights do you have about the most important considerations they should have for organizing this work?
Sure. So defined governance and collaboration is key for shared accountability. We talked about that we really hang on the defined framework for our sustainability program. And, we work on efforts stemming from climate action and resiliency, energy and water efficiency, waste management and reduction, sustainable sourcing, food and nutrition, the design and construction of our buildings to green building standards. So really having set strategic goals, SMART goals for that data-driven approach, fostering collaboration for shared wins, and really making sure that we set those strategic goals within our defined focus areas with governing leads and departments that are responsible for those areas of the operation. So, the SMART goals themselves and things that we do in from the energy usage and measuring our energy and water utility usage per site, driving efficiencies, the waste that we generate, volumes and costs associated with it, to even the food and beverages that we're purchasing and categorizing them as local or sustainably certified, the climate impacts of the food and beverages that we're purchasing, to various other kind of climate accounting that I'm sure we're going to get into in this discussion in the next few. So.
Great. So I appreciate that sort of goals first, understand what the work is, and then wrap your organizational structure around that. Is that a fair summary of what you were talking about, Shane?
Yeah, absolutely.
Great. Miranda, how about you? Let's hear about your structure and what you've learned in your 10 years of managing this work for an important health system. And you're on mute, Miranda. Thank you.
Unmuted now. Thank you. I'd like to echo what Shane said about collaboration. That's been really key in our work because there's so many different departments that touch sustainability. And while we do have a sustainability team, we have 5 people on our team currently, and we can't do it all. We rely on other people, we rely on their expertise, and really in the end, they're the ones that need to make that decision and own the program. And so our role within the organization is to really make those connections, to foster those collaborations and get people thinking in the right direction. So for our team, we have kind of 2 pieces to it. So we've got like the energy side. So we've got 2 folks there managing our energy and energy reduction projects. And then we also have 2 sustainability program managers that kind of manage everything else sustainability, including the data piece. So tracking our waste tonnage, tracking our greenhouse gas emissions, working on reports, but also program implementation. So I find it really important that organizations at least have someone. It doesn't have to be a whole team. It doesn't have to be a single person's job, but at least have someone that's responsible for implementing sustainability initiatives and fostering those collaborations.
Maybe just to follow up on that, back to you, Shane, I'm curious about how there's so many organizations have a small team of people who kind of lead the work, but it takes this whole, as you both talked about, a whole range of other people. The people who manage facilities need to make those decisions, and your folks in procurement need to make those decisions. And how do you knit those together through your organizational structure to make sure that while everybody's doing their job and incorporating the environmental components into that, how does it all sync up into a master plan that also syncs up into your organization's strategic plan?
Yeah, absolutely. So whether it's a organization strategic plan or a sustainability specific strategic plan or a climate action plan, really, we've seen a lot of value in really a committee-led approach and really a steering committee that we have from our end. So we have department leads, VP director level representation that really sit on a sustainability steering committee, because that allows us to take so many amazing resources, including but not limited to resources from the organizations holding this webinar, best practices from hospitals and health systems that have been aggregated, and bring those best practices to this group of thought leaders that are working on these efforts that we've, like we talked about, set goals for, have a defined framework within. So really the committee led approach has been very successful for us, allowing us to bring together leaders and operational leaders and thought leaders throughout the organization, and then also bring in other collaborators, contributors, innovators to be able to work with any defined sustainability resources, the steering committee, or in our end, we have a Greening the OR specialized committee working on reducing the impacts of the operating room and patient care areas, a Green Labs committee because Memorial Sloan Kettering has a very large laboratory presence, grassroots committees for anyone who wants to be involved in sustainability called the Green Reps. We have over 400 Green Reps. So just allowing to have those structures for the intake and prioritization, and then the execution and implementation of efforts aligned with industry best practices and opportunities that we have here at our organization.
Great, thank you for that. Miranda, anything else there that you want to add before we move on?
Yeah, I think we take a little bit of a different approach. We did try the committees at one point in the past, but I think based on our organizational culture, it was better to kind of have it centralized and then really just work individually with those teams. So I think you really have to look at your organizational culture and what works for you. There's not one framework that will fit with every single organization. So I think that's something you have to take into account.
Yeah, great, thank you. Well, let's now talk about some specifics. Shane, you teed this up a minute ago. What are the key priorities and actions that you recommend to health systems, particularly as they're coming into this work today? They want to ramp up decarbonization. Where should they start? So is it energy? Is it waste? What is it?
Yeah, really making sure that you can get as many people aboard. So the decarbonization, you have to link it to the industry call for action that we're hearing. The reason we're all here today, climate change and its impact on public health, it being the greatest challenge and that we're dealing with within the 21st century. We also link it to the mission, vision, values of our organization, specifically the values of innovation and stewardship. And that really helps us kind of really define how it is a clear-cut fit in our mission-driven organization. So to your questions on where you start, that really gets the conversation, the business case together, but then you really have to prove it in terms of that value add. So developing and determining high impact measures and categories with strategies to make sure that you can reduce impacts, but also measure those impacts. So energy is a great space because there is definitely low-hanging fruit. And when we're talking about climate, I'm a big fan of the climate and approach. So we're going to look into upgrading our facilities, driving energy efficiency, and reduce our climate impacts. We're going to provide and source healthier food and beverages for our staff, and we're going to quantify and reduce our climate impacts. We're going to look into more efficient optimization of our fleet to reduce our fuel expenditures, modernize our fleet, and reduce our climate impacts. And of course, you have to measure all these things, engaging clinicians on anesthetics and gas flow rates and the global warming potential of different anesthetic agents and gases, and educating on climate impacts and interventions. So these areas and number of resources available, publicly available resources on where to start, it's really a lot of that, the low-hanging fruit, and it really often goes back to some of those big pillars: energy, waste, procurement as well, kit reformulation, sustainable sourcing strategies. but things that you're actively able to engage in and measure. And I believe there's a number of the organizations here have great resources to help the industry measure impacts from some of those intervention and efforts that I was mentioning.
Yeah, thank you. I really appreciate that. Like what you can measure today, what you can do today, start with that. And I will loop back on the procurement piece, because the supplies we use contribute greatly to our greenhouse gas emissions footprint. But before I come back and ask you about that, Miranda, please tell us what you recommend to folks that are newer to this work around key priorities and actions, and why you've got the list you've got.
Yes. Well, I will say if I had to start all over in my journey on sustainability, I would start with energy. It's really a huge impact, not only on your emissions, but also money. There's so much money to be saved, or as we say, cost avoided, whenever you're reducing your energy use. So it's also good for the systems itself too. So, reducing your demand, you're not running a chiller at 100%, you're running it at 60. So really it's expanding the life of those things too. But if you're not able to start with energy, all I would say is start somewhere. Like wherever you are, start, because that's what's going to get you going on the mission towards sustainability. We actually started with recycling. It was cardboard, and then it was batteries, and then after batteries, it was single stream. And so that was really where we started. Whenever you look at greenhouse gas emissions, that's maybe a lower piece of that, but it still makes a difference. So if you can add all those little pieces up, eventually it really does make a big difference. So that's where I would start.
And maybe I can just come back to you, Miranda, on the procurement piece, because it's considered generally not that simple, and maybe you don't. It's not easy to measure. But is there anything for somebody kind of starting out in this work to say, is there something you could be doing with the supplies you buy that would make a difference, and not be unrealistic to try in the near term?
Yeah, I would say reach out to your vendors if maybe you have a particular idea in mind, maybe you don't, but if you're part of a group purchasing organization, reach out to them, and they may be able to run a report to say, what products can I get that are more green, but also save money. And so looking at those two pillars at least, and saying maybe this is where we should start, because being able to measure our greenhouse gas emissions within purchasing is a very, very difficult task. But, why don't we look at other benefits in that?
Great. Shane, anything you want to add on that supply piece?
Yeah, I mean, from the purchasing end, definitely the GPO engagement piece. Work with your GPO. It's a reason you're a member. Take advantage of the resources that they have. Talk about your priorities for sustainability or sustainable sourcing, or even supply chain efficiencies and such with them as well. And there's a lot of efforts to pursue. I mean, reprocessing programs have a immediate return on investment, drive a bit of that kind of circularity mindset into some of the purchasing, and things that have the benefits, OR, just general kit reformulation, that you're working with your vendors to, make sure that excess items in your kits that aren't being utilized, you avoid them from your kits, you avoid those purchases, and you avoid the waste because those items weren't being utilized. So when you're looking at maybe some of those low-hanging fruits, we even have a paper reduction program here at MSK that we do every year. We track the paper usage, work on kind of the digital tools that we have available to us internally. And, because we're not only reducing the paper that we consume, we're reducing the toner that we need to purchase for the printers, reducing the transportation impacts of the paper coming to and from. We're in New York City for a lot of our facilities. Space is at a premium. There's not even really space to store things like paper. So there's a lot of kind of those efficiencies from, low-hanging fruit purchasing end. energy, like Miranda said, great place to start. We have an industry leading energy efficiency program. Our plant ops team is quite excellent, but they're constantly pursuing things, LED lighting and HVAC setbacks in the operating rooms when they're not in use, and timers on autoclaves we saw recently, and behavior change programs, things like that. We even have a computer shutdown program where our information technology team built a little scheduler into our workstations that you can set a schedule to shut down all of our workstations overnight, and we save over $350,000 a year by shutting over 16,000 computers down overnight.
Wow. To pick up on that affordability piece, let's move to that now. You've both given examples of how what you're doing has saved a lot of money. So Shane, let me start with you. Just continue on some examples you have about affordability and what tools or information are helpful in sharing cost savings and cost avoidance within your organization, particularly your leadership structure.
Yeah, being engaged with Healthcare Without Harm and Practice Greenhealth, the wealth of tools that they have, Practice Greenhealth has things like the total cost of ownership calculator. We've seen value in participating in the Practice Greenhealth Environmental Excellence Awards and using that as really a industry benchmarking tool for where we sit within the industry, but also tracking and trending a lot of KPIs metrics, including cost savings across our program framework. Really anything that we tracked and pursue interventions, we set up and leverage some of our more tech savvy folks to generate Tableau or Power BI dashboards, or I know our plant ops folks use Energy Star Portfolio Manager and such for tracking the energy efficiency, energy use per square footage, and the associated greenhouse gas emissions with some of those tools. So a lot of those types of tools are things that we kind of leverage here internally. And even though we've been at it for a decade and stuff, there's still a lot of Excel spreadsheets and really return on investments tracking year over year by really years in a column, projects in a row, and tracking them that way. So a lot of that's still going on.
Thank you. Miranda, please share with us how you think about affordability and how you share that information and what tools you use.
Yeah, I will echo what Shane said about the Excel spreadsheets. We do still do a lot of tracking on those, mainly in energy. That's our big one that we can track, and we can talk about, peak demand and how do we reduce that. And, here's our consumption year over year. You can see, where we were going down, and then something breaks down on a piece of equipment, and then our energy's back up. And you can just see these trends. And it's just really cool to be able to show that to leadership and say, hey, over time, this is what we're doing, and this is how we're saving money. So yeah, Excel spreadsheets is the big one. We do use Energy Star for tracking. Our main campus is actually the largest Energy Star certified healthcare campus in the US right now, over 3 million square feet. So we're really excited about that, and that's something that we can share with our C-suite and external stakeholders to say, hey, look at all the great things that we're doing. We have verification through this other system. So
yeah, I mean, you've both mentioned Energy Star, and that's a great tool, and tracking energy utilization as another way to think about energy use. I also was interested in, you've both talked about spreadsheets, which we all love, but how would you recommend people kind of develop their own tools if they're kind of starting in this, or really utilize some of these other things like Energy Star as a starting point and fill in as needed?
I could take this one to start. I mean, those tools are great to get started for sure to quantify. Something that we've had success with on our climate action journey. We worked with the Environmental Defense Fund, and they have a Climate Corps Fellowship where we had Climate Corps fellows come in during the summer and collaborate with us to develop a greenhouse gas accounting tool and an inventory management plan. And it really unlocked and allowed us to track and trend our scope 1 and scope 2 emissions. So that's really things like scope 1 being emissions that are from combustion on site, anesthetic gases and refrigerants and fleet vehicles, and any energy combust on site. Scope 2, really all your kind of emissions from purchase energy and such. And it used, these fellows were great, but it is a glorified Excel spreadsheet with a lot of macros and calculations, pivot tables, and it used publicly available data sets to calculate things that we plug in, inventory management plan to collect the data and pull things from like EPA, the e-grid factors for carbon intensity for different regions, Practice Greenhealth, anesthetic gas, global warming potential, combustion factors for fuel, and really helped us kind of develop that internal tool there over a couple month period. So, and then we've been refining it over the last few, but really allows us to track, trend, and display our climate action journey here.
Great, thank you, Shane. Miranda, did I understand in a prior conversation we had that you use the Cool Food Pledge as a tool? Is that something that you want to share any information about, or?
Yeah, that was, I'm not super familiar. It must have been Shane.
It must have been Shane. Okay.
And
Shane,
absolutely,
tell us about the Cool Food.
I would love to mention Cool Food because it has really been a value. We're just starting our journey on scope 3. We measure only a few categories, but we joined the Cool Food Pledge through the World Resources Institute. We submit our food and beverage purchases annually, and they actually act as an additional resource for us, and they calculate the greenhouse gas emissions from our food and beverage purchases and provide us with tailored, polished reports every year for us to track our progress towards the agreed upon goal of a 25% reduction in greenhouse gas emissions by 2030. And we chose 2018 as our baseline year. We needed a solid year before COVID turned everything upside down. And yeah, it's working with collaboratives like the ones we're talking about today, working and pledging with Cool Food Pledges. These are additional resources that unlocked the potential for us where we don't have the resources internally to do this. The assistance in really helping measure, track, and provide guidance and interventions through webinars and such for how we can reduce our emissions. So it's been great, the journey with them.
Thank you. Thank you both for all that great advice. I want to switch gears, and Shane, I'm going to come back to you on this one, and then we'll move to our last question. But I wanted to talk about patient safety and quality and how, Shane, and your organization, how do you advance the climate work and decarbonization? How do you engage health professionals? And what is the relationship to your work and quality care?
Yeah, that's something that's really been unlocked in the last few years through our collaboration with, I'm working with IHI on some of their learning communities. It really showed the commonalities between sustainability and some defined quality and safety efforts here internally. I mean, it's rooted, we're working on quality and process improvement to reduce resource consumption, seeking to measure things like our emissions and put forth interventions to reduce, and all of this to address health burdens and protect vulnerable patient populations like immunosuppressant cancer patients that are treated here at MSK, and drive positive outcomes through safe, efficient, and lower carbon healthcare. So that's what we're working towards. And the quality and safety aspect of it has been great in fitting in with our efforts because they do such a wonderful job using processes, defined models, and interventions to measure progress. And that's exactly what we're looking to do here. So that's a good example of a collaboration and kind of linking up shared objectives and goals and really feeding into each other's work.
Great. Thank you so much for that. Well, I've left you each all of 1 minute each to, and I'll start with you, Miranda, to answer this super easy question. What's the next step for you at your organization and your sustainability journey? And what are you working on in real time?
Yeah, our big thing right now is to really just integrate sustainability into our daily work. So, how do we make this something that's part of what we do, not something extra? So, we're looking at, how do we integrate this into our goals for the whole organization? How do we integrate this into our strategic plan? How do we get it beyond just, a few departments that have participated in the past? Just really looking at that. And then as far as kind of individual pieces go, we're looking at adding rooftop solar panels in the next year, expanding EV charging. Currently, we're working on our dust Lorraine project, which is going really well. So big success there. I'm pretty excited about. So fleet decarbonization, we're moving along in that journey. So those are some of our big ones.
Beautiful.
And
Shane, please take us home. What are you working
on? Yeah, just continue kind of optimization of the efforts here at MSK, really making sure that we have implementation and execution throughout our regional network, along with the strength of the programs within the city main campus and the efforts here. Taking on Scope 3 inventory and looking in, meeting goals set, climate action resiliency goals. We modeled after the HHS healthcare pledge and things along those lines. So Scope 3, big undertaking, some actual quantification, some spend-based, looking to leverage tools that are publicly available. Plant operations teams looking in decarbonization master plans, meeting New York City climate regulations. So setting ourselves up for the next kind of 5, 10 plus years of, driving sustainability, resiliency, and continued operations here at MSK.
Thank you both so much for all the expertise, your positive attitude about this work, and your willingness to share it with everyone today. So much appreciation, and we're going to move on now to the next piece where you're going to learn all about the great tools available to you, and I'm going to turn it over to Bhargavi to introduce herself and take it from here. Thanks, everybody.
Thank you, Kathy. Hi, my name is Bhargavi Sampath. I'm a senior researcher at the Institute for Healthcare Improvement. And I just want to talk about one resource that'll help organizations get a little bit of background around this topic. So I would suggest reviewing the AHRQ primer on reducing healthcare carbon emissions. The impetus for this resource came from the Biden-Harris administration's national emissions reduction goals and the White House HHS pledge initiative aligned with those ambitions. Oh, I see the slides didn't progress. Oh, there we go. Thank you. So to support healthcare organizations to begin their journey towards decarbonization, the resource outlines 3 things: a prioritized set of standardized measures to track and manage greenhouse gas emissions, a short list of strategies focused on reducing waste and emissions intensity to move the dial on these measures, and a few illustrative examples from health systems that are leading the way in healthcare decarbonization. The measures, actions, and examples are organized around a few areas of opportunity that were identified as significant carbon hotspots in healthcare. And in addition to the primer, there are some wonderful resources that are publicly available that can also provide some useful context around this topic. There are publications coming out of the National Academy of Medicine and a vast repository of resources and webinars from the Office of Climate Change and Health Equity. With that, I'll pass the virtual mic over to Keith.
Thank you, Bhargavi. Hi, everyone. It's great to be on this call today. My name is Keith Edgerton. I'm the U.S. Director of Climate Solutions for Healthcare Without Harm. And we wanted to share a free public tool for U.S. health systems. It's great to hear Shane and Miranda share about their journey to develop an inventory and an action plan. We know there's a sense of urgency out there if we believe the climate crisis is real, and we know in order to achieve net zero emissions, by 2050, and probably more importantly, to have a 50% reduction in all three scopes by 2030, we need to not only develop an action plan, but we really do need to develop a complete inventory. So Healthcare Without Harm and Practice Greenhealth decided to take a carbon calculator that has been developed over the last several years and put that in front of the paywall. The Healthcare Emissions Impact Calculator is built for U.S. health systems. It uses data sets from the EPA for all three scopes. As many of you probably know, Scope 3 for an EPA data set is a spend-based methodology. We do have some modes of transportation and mileage built into certain categories in Scope 3, but it's mostly spend-based. This calculator is built for facilities and system. We believe that it's important to see your overall system greenhouse gas emissions, but to really find the outliers, good and bad, at a facility level, comparing similar facilities to one another to see if they are operating similarly, but also to see activities at a facility level. So this calculator allows you, it's an Excel sheet. It allows you to develop up to 300 facilities. You can put those all into one folder, and then you're able to upload that one folder at one time into the system Excel sheet. And there you can compare all the facilities uploaded. And as I mentioned, you can also see the system level. So something that we hope supports U.S. health systems in their journey to develop inventory and an action plan. And we just hope everyone uses it and likes it. So with that, I'm going to pass this on to Justin.
Thank you so much, Keith. Hello, everyone. My name is Justin Massey, and I am an Associate Program Officer at the National Academy of Medicine, where I work on the Action Collaborative on Decarbonizing the U.S. Health Sector, also known as the Climate Collaborative. As Kathy mentioned earlier in the broadcast, the Climate Collaborative is a public-private partnership that convenes leaders from across the health sector to co-develop and implement a shared action agenda to reduce the carbon footprint of the health sector and strengthen its resilience. The collaborative has 4 areas of focus that correspond with the working groups: healthcare supply chain, healthcare delivery, health professional education and communication, and policy, financing, and metrics. Members from across the collaborative represent many stakeholders such as hospital systems, clinicians, healthcare distributors, biopharmaceutical and medical device companies, academia, nonprofits, and the federal government. Each working group defines its own set of goals, activities, and products, one of which you will see on the screen that I'll be highlighting today. As part of their recent initiatives, members of the Healthcare Delivery Working Group recognize the importance of developing and implementing a consolidated list that gathers established methods, resources, and tools for decarbonizing healthcare organizations. Their working group charge is to scale sustainable, quality, and equitable healthcare operations and practices, including reducing the carbon footprint of healthcare delivery organization and unnecessary healthcare services. So expanding upon this objective, the working group developed a high-level, concise, short list of key actions for hospitals and health systems to reduce their greenhouse gas emissions. This list is meant for hospitals and health systems either starting their journey or seeking to implement actions to decarbonize, and is meant to be a resource for hospitals and health systems asking, where do I start, or what do I do next? So the actions and priorities in the list build upon and link to existing resources, playbooks, and tools. Several have been already highlighted today. The list is comprised of 2 informational steps, including associated actions and resources for each. Step 1 includes 4 specific actions that hospitals and health systems can take to set and meet goals to reduce greenhouse gas emissions, such as performing a greenhouse gas inventory or establishing decarbonization goals. Step 2 includes 5 high-impact interventions to reduce greenhouse gas emissions, such as reducing building emissions, reducing anesthetic gas, and or reducing physical waste and single-use plastics. So there is a resources link at the bottom of the shortlist webpage for reference, but in the coming weeks, NAM will be releasing the shortlist in conjunction with our Carbon Clinics webinar series that was developed by the Policy, Financing, Metrics Working Group, which was a recorded webinar series that covers the basics of carbon accounting, the process of measuring, tracking, and reporting an organization's greenhouse gas emissions, and includes real-world examples to learn from. These resources can help organizations identify the next step to take at all stages of their decarbonization journeys. So using these resources together, hospitals and health systems will be prepared to take efficient and effective action to reduce their carbon footprints and protect the health of the communities they serve. But complementing these efforts, the HHS IRA Quick Finder is another resource that highlights potential investments and opportunities for healthcare organizations to reduce their carbon footprint. Some of the key areas include energy efficiency building improvements, increased building resilience, decarbonizing the healthcare supply chain, and increased community resilience. Aligning with the goals of the Climate Collaborative, this resource can help healthcare organizations identify specific actions they take to reduce their greenhouse gas emissions. Additionally, the HHS Health Sector Resource Hub is another resource that can be useful for healthcare organizations seeking to decarbonize, as it includes a variety of tools and resources related to climate change and health, including case studies and success stories from healthcare organizations that have implemented decarbonization strategies, guidance on measuring and reporting greenhouse gas emissions, information on policy and regulatory developments related to climate change and health, and resources for engaging with stakeholders and building partnerships. This hub can be a valuable source of information and guidance for healthcare organizations looking to take action on climate change and reduce their carbon footprint. So we hope you take the time to explore these resources and visit our Climate Collaborative webpage to learn more about the key actions and Carbon Accounting 101 resources. But with that, I will turn the discussion back to you, Kathy, for closing remarks. Thank you.
Thank you. Phew. Those were some massive tools and information being shared by these groups. And what I love about that is that there is no reason to proceed with this work without taking advantage of these super helpful, accessible, easy to use tools that everybody talked about for calculating your emissions, for creating a prioritized plan, for knowing where to start. So thank you for all the work that went into that. We're gonna now do a couple of things back on Slido. So we wanna ask you 2 closing questions. And as you see on the screen again, you can either scan the QR code or go to the website slido.com and enter that event code. And the first question that you'll see is, it's a multiple choice. What type of organization do you represent? So if you could take a moment to answer that question, and then we will move to the word cloud slide to see what you're doing. So why don't we go ahead and go to the next slide and see the results of what type of organization you're in. So not too many answers yet. If folks are able to log on to Slido, there we go. Well, great. Great. Okay, thank you for participating in that. So glad that we have lots of health systems represented and a very nice mix of types of organizations. So thank you for that. Why don't we go ahead and go to the second question? And that one is, what other topics would you be interested in learning more about? This again is multiple choice. So let us know what you want to hear more about. Yeah, just as we're thinking about health professional engagement and advocacy, I really appreciate the comments from our panelists around recruitment and retention, using actions around climate for folks who are really interested in that and want to come to your organization because you do that. And clearly a need for business case. So heard loud and clear, and I hope you take advantage of all those great tools you learned about, because many of them will help you with that business case. Well, great. Well, I think we can wrap it up now. I really want to thank everybody for joining us. And if we go to the next slide, our closing slide, you will get an email address in case you have any questions. And I hope you've enjoyed participating in the live stream Q&A technology that we made available to you. So I just want to thank all the experts who shared their valuable insights and resources. I want to thank all of the participants today who were here to learn more about the methods and means to accelerate your organization's decarbonization journey. Really appreciate all of your participation. All the best to you from all of us. And thank you for being here. Take care.